would you like to come on up in just a second? I'll just wait till Alison comes back. Would you like to come on up? We'll just go straight into your walk.
Good afternoon, everybody. It's a pleasure to be here to form a welcome to country on the land of the Ngunnawal people, who are the traditional owners of the land that we are meeting on this afternoon. Firstly, I would like to congratulate the two recipients of the awards. Congratulations to Pat Turner. I know she's a hard worker and puts 100% into it. So congratulations, Pat. And also congratulations, I've been told, to the ANU fire recovery team that is getting an award today as well. So that's a very important issue as well. So congratulations to both of them, and it's a pleasure to be here. My name's Violet Sheridan. I'm a Ngunnawal elder, and I'll go into the welcome. I don't want to, because I tell you I can talk underwater. Every time a formal welcome to country is given, it continues a tradition that has always been a part of Aboriginal culture, except maybe for a lapse of about 200 years. It was always given by way of welcome when permission was granted to visit a different tribal area. The reason for this custom is to protect your spirit while you are there, and it also shows respect to the First Peoples of the land you are meeting on. When we talk about traditional country, we mean something beyond the dictionary definition for the word Aboriginal Australians. We might mean homeland or tribal or clan area, and we might mean just a place on the map. For us, country is a word for all values, places, resources, and culture, stories and culture obligations associated with that area and its ancestral domains. It is on this land, possibly right here where we meet, that my ancestors lived, cared, and raised their families. I'd like to acknowledge and pay my respects to my elders, past, present, and emerging, and extend that respect to other Aboriginal and Torres Strait Islander people here present this afternoon. I'd also like to acknowledge special guests, award recipients, ladies and gentlemen. In keeping the general spirit of friendship and reconciliation, it gives me great pleasure to welcome you all here this afternoon on behalf of my people, the Ngunnawal people, who are the traditionals of the land that we are meeting on. And I'm a big supporter of climate change, so please take care of this land for our next generation. I have 26 grannies, 2 great grandchildren, so I'd like the land to be the same in the next generation. And if I don't see you before Christmas, I wish you a Merry Christmas and safe and Happy New Year. God bless. Thank you.
Thank you very much indeed, Auntie Violet, for that very warm and informative welcome to country, and I'm sure we'll all work very hard to ensure that the land is as it should be for your great-great-grandchildren and ours, for that matter. Not that I've got any of those yet, but I do have some great-grandchildren. I'm waiting. They're only 13, so I'll be waiting a while. Look, thank you very much, and again, and I'd like also to start by acknowledging the traditional owners of the land on which we are meeting and their elders, past, present and future, and both here and in whatever country you are visiting us from, because today's meeting is a combination, it's a hybrid meeting of in-person and those online. So wherever you are, we pay respect to the Indigenous communities of those lands. For those of you who don't know me, my name is Jillian Skinner. I'm the chair of the Australian Healthcare and Hospitals Association, and it's my very great pleasure to welcome you to today's Sidney Sax Award ceremony. For more than 30 years, AHHA has honoured the outstanding health leaders of our country for their contributions to the development and improvement of the Australian healthcare system with this award, the annual Sidney Sax Award. And it really gives me a great deal of pleasure to continue to this tradition today as we present our 2020 Sidney Sax medals. And it's the first time I've met some of these staff face to face, and I think it's a most appropriate time for us to come out of hiding for this very special award. The Sidney Sax is an icon of the Australian health sector, as I'm sure all of you will know. Maybe his greatest contribution was the development of Medibank, the predecessor to Medicare. And it was in the very early 70s that he convinced then Prime Minister Gough Whitlam to work with the states to provide Commonwealth funding for public hospitals. This, together with the MBS, the Medical Benefit Scheme, and the Pharmaceutical Benefit Scheme, underpins the universal health system we are so fortunate to have in Australia. And I can tell you, as a former Member of Parliament, God forbid anyone ever tries to tamper with Medicare. You will be out of office tomorrow. So don't even try. And can I tell you, having spent a number of visits overseas to the United Kingdom, to America, to different parts of Southeast Asia, our health system is the envy of the world. We can always improve things, but generally, we are really envied around the world. And I think the fact that universal healthcare has been a key pillar and defining feature of the Australian healthcare system was never more evidently important than this year, of course, not only with the bushfires and how we had to deal with those, but also grappling with COVID-19. And the fact that I think the strength of our publicly funded health system and affordability of care have been critical to the success of Australia in protecting the health of its citizens, both during natural disasters and the pandemic. But returning to Dr. Sax, his influence in health planning and practice didn't end there with Medibank, of course. He worked with subsequent Prime Ministers, Fraser and Hawke, and his many achievements included establishment of the NHMRC, the National Health and Medical Research Council, and the Australian Institute of Health and Welfare. The inspiration for the awards we are presenting today is appropriately here because from around 1983, Sid Sax was a visiting fellow at ANU. And together with colleagues like Professor John Deeble, for whom our Deeble Institute is named, Sid Sax helped ANU position itself as a leading institution in Australia in its contribution to health systems research and health policy development. We're very grateful for the ongoing support and contributions ANU provides us for our work at AHHA, and particularly for hosting us here today for the Sid Sax Awards. And before I present the awards, I would now like to invite Professor Russell Groun to say a few words. Welcome, Russell. Thank you.
Thanks, Jillian, and all of the Australian Healthcare and Hospitals Association. Thank you, Auntie, for your welcome. And thanks to the Ngunnawal people of whose land we share with this beautiful campus at the Australian National University in Canberra. In the first week of January, as bushfires raged across the country and thick smoke blanketed Canberra, I gathered my senior team and asked them, what is the role of the National University in this crisis? All of us had personally experienced the summer from hell, and a front page headline in the New York Times read, "Australia shows us the road to hell." Several months during which fire burnt an area equivalent to the size of England, destroyed thousands of buildings, and killed an estimated 3 billion animals. Of the people who sat around the table that day, some had defended and some had lost property, and most had lost their summer holidays. I had 35 friends staying at my home who had fled the South Coast fires. At the time, Canberra recorded the worst air quality in the world for several days in a row. The smoke was so thick that it seemed always in our eyes, our mouths, and our clothes. We were wearing masks before they became fashionable. This first impromptu meeting of our leadership team and subsequent daily meetings took place in our homes and in a medical consulting room because the air conditioning in many public buildings just couldn't cope. We came together daily for the first 2 weeks of January, both to support each other and to support our country. You'll hear more about what eventuated from Professor Robin Lucas and Dr. Anna-Greta Hunter. And I'd like you to consider it in the context of the role of our national university. As you mentioned, Jillian, Sidney Sax was a fellow here at the Australian National University, which is the only university constituted under Commonwealth legislation to serve the Australian people. Founded in 1946 to be an intellectual powerhouse for knowledge creation and development of the necessary expertise to address complex post-war problems, things such as poverty, unemployment, illness, social injustice, and ethnic and racial prejudice. It was understood by our founders that these problems had physical, social, geopolitical, and biological dimensions. So it was that the first 4 schools of the university, physics, social sciences, Pacific Studies, and our John Curtin School of Medical Research, paved the way for nation building. In 75 years, ANU has developed depth of expertise, won 6 Nobel Prizes, and maintained top 10 in the world status in several fields of political, social, and physical sciences. Yet it was through this last bushfire season and the rest of 2020 that we have revisited the foundational ideas that nation building requires dedication, commitment, and expertise, and that multiple perspectives are required to fully address complex problems. They seem as relevant today as they have ever been. Many of my colleagues have discovered new ways of working. 35 senior faculty from my college were seconded to Commonwealth, state and territory government departments, to NACCHO and to other public sector organisations, where they provided expertise, developed policy, and provided surge capacity for the work of government itself. Those on the front lines rolled up their sleeves and worked with and alongside their communities in crisis. Experts in air pollution and science communication quickly mobilised to fill the gap in reliable information going out to affected and worried people, and were translated into multiple languages and disseminated widely to ethnic and disadvantaged communities. ANU rapidly set up air quality monitoring stations, tests for lung function of at-risk people, and went about assessing the impact of bushfires on local communities and their health services. Training webinars were rolled out for hundreds of health professionals around the country who were managing crisis-affected communities. We worked across the sector to contribute our knowledge to the nation, and those with relationships with our regional neighbours, with NGOs and with the WHO were mobilised and continue to this day to provide their expertise. These are not traditional ways of working for academics or for universities, either in nature or in timeframes. But they could and should be. This year, the Australian public has learnt the value of breadth and depth of expertise in the public discourse. We've seen the important roles that engaged experts play and have gained insights into how to embrace complexity and integrate different perspectives. We've learnt the importance of institutions like ANU that have deep understanding of the challenges in our world and the challenges faced by the people responsible for addressing them. We have learned that we achieve progress through science, wisdom through collaboration, and impact through engagement. I was reminded why we do this at last month's opening of a new training facility for ANU medical students and University of Canberra nursing students in the south coast New South Wales town of Bega. The Mayor of Bega Valley Shire, Russell Fitzharris, explained that 60% of the Shire had burnt last summer, 500 homes were destroyed, and 7,000 people were displaced. Most of them, he said, are still living in caravans today. Through all of this, and through the long months of recovery, he said that one of the things that made a difference was outreach from ANU's Research School of Psychology to support the many mental health and community support needs. In 2020, we are all, I think, forever changed. Everyone, everywhere. Universities will be too. And we at ANU are ready for a new round of nation building. It's a real privilege for me to be among bright, well-intentioned people who rise to tackle the nation's most significant challenges. I relish their inspiration and achievements, especially those of our students and early career researchers, for whom this year will define the way they imagine their future professional careers. Sidney Sax would, I think, be both excited and proud. Thank you.
Thank you very much indeed, Russell, for a very thoughtful and thought-provoking talk to us, and I agree with you. I don't think we'll ever be the same beyond this, but out of adversity, really new opportunities arise and great strengths, and I think you've reflected that in your words, so thank you very much for being here and saying those few words for us. We now turn to the first of our medals, and I'd invite Patricia Turner to join me on the stage here. Can you manage those stairs?
Yeah.
I'm going, just if you'd like to just wait there a second, I'm going to embarrass you by telling everyone who you are. As the COVID-19 pandemic began to impact Australia's health system and communities, Patricia Turner, Chief Executive of the National Aboriginal Community Controlled Health Organisation, played a significant leadership role in ensuring that the Commonwealth and the state and territory governments took urgent action to protect Aboriginal and Torres Strait Islander communities, closing down access to communities and prioritising safety to prevent community transmission of COVID-19. In comparison to the devastating incidence of COVID-19 in Indigenous communities abroad, rates of COVID-19 in First Nations peoples in Australia remain proportionately lower than the rest of the population. That's a fantastic achievement. This successful model of community leadership will have long-term positive impact for Aboriginal and Torres Strait Islander communities working in partnership with governments. But it would not have been possible without the very, I'm told, proactive determination of Pat Turner and her colleagues across the Aboriginal controlled health sector to ensure that Aboriginal and Torres Strait Islander peoples would be at the forefront of planning the response to the pandemic. Her advocacy highlighted the importance of a strength-based approach to healthcare for Aboriginal and Torres Strait Islander peoples, placing cultural safety and community leadership at the centre of decision-making. Pat, it gives me great pleasure to present you with one of our two 2020 Sidney Sax Awards for Health Policy Leadership today. Here we are.
Lovely, thank you.
You taking photographs, or why don't we?
Thank you very
I'm an
much.
old minister, I know how to do this. Thank you. It's marvellous.
Thank you very
Thank you
much.
for your commitment and dedication and your unwavering leadership in working towards achieving the best possible health outcomes for Aboriginal and Torres Strait Islander peoples. And our audience, I know, is very keen to hear about your work. Over to you.
Thank you
Thanks,
very much,
Pat.
Jillian. I am the daughter of an Oranda man and a Gadangji woman. I wish to begin by acknowledging the country and the traditional owners of the land we are meeting on today. We are meeting on Ngunnawal country, as Auntie Violet said. I too pay my respects to the elders past and present and thank them for their continuing openness to have us live, work and meet on their land. This Indigenous practice of acknowledging your place and the place you are on is something that has existed for thousands of generations. It is a way of being heard. It is an exchange that ensures safety and exhibits respect whenever a person crosses into another's land. This sincere I always get stuck on this word. Reciprocity between First Nations, I'm never going to have this word in my speech again, between First Nations people is a tradition we now share with all Australians in acknowledging country. As this year's recipient of the Sidney Sax Medal, along with the ANU College of Health and Medicine's Bushfire Impact Working Group, I am very honoured to have been selected for inclusion in a long and impressive list of eminent leaders and agents of change in Australian healthcare. I congratulate my joint awardees for their well-deserved recognition. I am especially touched to be following Vicky Wade, who received this award in 2019 for her many achievements. Vicky and I share resolute commitment to eradicating a rheumatic heart disease among Aboriginal and Torres Strait Islander populations. With respect to RHD, we cannot rest until we have achieved equity for my people with the outcomes in prevention and treatment already achieved for the non-Indigenous population. By this I mean 0 new cases of acute rheumatic fever, 0 new cases of rheumatic heart disease, and no one dying as a result of rheumatic heart disease. No one. To Vicky and all previous award recipients, I express my sincere appreciation for their contributions and commitment to health and well-being and to a more effective, efficient and sustainable health system. I too would also like to take this opportunity to reflect a little about Dr. Sidney Sax. It is said that behind his unassuming manner lay a fierce radical. It was this fierce but responsible radicalism that we see in Dr. Sax's legacy. His role in introducing the Australian Community Health Program, his role as the first chairman of the Hospitals and Health Services Commission during the Whitlam government, his leadership as the first chairman of the NH&MRC Health and Research Development Committee, his books and many writings. With foresight, he identified the need for strategic focus and action on health inequity, social determinants of health, regional health planning, and the importance of navigating the strife of interests not always rowing in the same direction for health reform. I'd like to think that Dr. Sax would be pleased to see the results of Australia's community-controlled primary healthcare organisations in improving the health outcomes for their communities. In 1971, our first community-controlled Aboriginal medical service was established in Redfern. Next year, the Redfern AMS will be celebrating its 50th birthday. Throughout Australia, these 50 years have seen momentous changes in Aboriginal power, leadership and impact. As a country, we have had our ups and downs as we try to forge more authentic, equal and effective partnerships between Aboriginal and Torres Strait Islander and non-Indigenous Australians. But let me share with you today some of the reasons for my optimism. I joined the National Aboriginal Community Controlled Health Organisation as CEO in 2016. Our sector has developed unique models of care grounded in community control and cultural authority. By adhering through these models to the principles of the original Alma Ata Declaration for Comprehensive Primary Health Care, community-controlled health services ensure that health and well-being are improved through collective public health action, as well as individual clinical approaches. As we all know from the Untitled Chapter in 1986, prevention is as important as treatment. Health promotion in the hands of the people themselves is more effective than the efforts of visiting experts who have little community connection or understanding. Through employment, engagement, empowerment, and social action, community-controlled health services are a proven mechanism for Aboriginal people to take responsibility over their health matters. Yet improving Aboriginal and Torres Strait Islander health and well-being through primary health care takes place in challenging circumstances. Despite this, we have great news. Evidence points to the community-controlled primary healthcare sector as highly cost-effective when primary, secondary and tertiary prevention are integrated and directed according to community need and prioritisation. One major study concluded that 50% more health gain could be achieved if health programs were delivered to Aboriginal populations via Aboriginal community control, compared to the return on investment if the same programs were delivered via mainstream primary healthcare services. Let me give you a few examples. Our care models lead to better outcomes for Aboriginal people with chronic kidney disease, as shown by the Danila-Dilba Health Service in Darwin. As a baseline measure, way back in 2007, only 60% of patients with renal disease were being identified with this diagnosis. Screening of at-risk patients was very low, although there were over 500 patients with diabetes, for example. Few of these had been screened for chronic renal disease. Only 26% of patients with chronic renal disease had clear clinical goals determining their care. In response, Danila-Dilba established a new position of renal case manager in its clinic. Through this new role, all members of the primary healthcare team were supported in providing systematic patient monitoring and access to the latest advice regarding evidence-based practice applicable to specific patients. As a learning organisation, Danila-Dilba commissioned their own independent evaluation of these services. Using 10-year data, this independent evaluation documented increased screening and monitoring of people under their care with stage 3 to stage 5 chronic renal disease. Access to expert knowledge increased the organisation's competence to recognise and effectively manage patients with chronic renal disease and associated comorbidities. But it is also the case that the risk of tertiary renal services taking over the management of Aboriginal people in their latter stages of chronic renal disease to the exclusion of their other health priorities was avoided. While the average clinical contact with GPs of patients in stage 3 renal disease remained relatively unchanged at about 60 per year, contact of patients in renal disease stages 4 and 5 almost tripled. As a result of this initiative, those patients with both renal disease and diabetes were better managed in terms of meeting agreed evidence-based targets for diabetes control. The proportion of patients meeting specific clinical targets has sat consistently above 90% since 2012. Prior to Dunelma-Dilba's model of care, 50% of patients ended up with stage 5 within 2.5 years of identification. In a cohort study included in the evaluation, progression slowed down dramatically. Rather than 2.5 years, the time it took to progress extended out to 4 years. This is a significant positive improvement in clinical outcomes. Overall, this experience has shifted Dunelma-Dilba to a systems approach. Through their multidisciplinary systems approach, with support from the tertiary hospital service, Dunelma-Dilba is preventing disease onset through effective risk factor management and preparing people with serious renal disease and their families for prompt dialysis. And second, the second community-controlled example in chronic renal disease is from the Kimberley region in northern Western Australia. There, the Kimberley Aboriginal Medical Services, known as CAMS, has taken a pioneering step in becoming the first Aboriginal community-controlled renal healthcare service in Australia, quite possibly the world. This service is known as the Kimberley Renal Services, known as KRS, a wholly owned subsidiary of CAMS. By running KRS itself, CAMS ensures culturally appropriate dialysis services is available to Aboriginal people with chronic renal disease close to home. CAMS has capacity for more than 100 people to receive life-saving hemodialysis treatment on country rather than being stranded in Perth. KRS has ensured a multidisciplinary team approach is available to support people throughout their renal healthcare journey. Access to renal health centres is provided 6 days a week, Monday to Saturday, all year round. The only days that the service is not available are Sundays and Christmas Day. More dialysis chairs are being planned. CAMS has been a powerful advocate for the clinical services people with chronic renal disease in the Kimberley require. There is a focus on local Aboriginal staff in each site, learning and doing and caring for their families and communities in jobs vital for the community, including Aboriginal health workers, patient care assistants, Aboriginal care coordinators and Aboriginal nurses. This team is supported by 3 renal GPs who are fully credentialed GPs who have deliberately added renal disease as a special area of their expertise. This is particularly important in the Kimberley region that does not have a nephrologist in the region, but only a FIFO visiting service, FIFO fly-in, fly-out. Any way you look at renal disease in Aboriginal people, the only solutions that will work in the long term are those that are Aboriginal-led, culturally responsive, located in Aboriginal organisations and evaluated through an Aboriginal lens. Our sector has used clinical quality improvement methods for decades. We reach out to increase health checks, health promotion and community development. Continuity of care in community-controlled services decreases rates of hospitalisation. Communities direct us, communities trust us. Very recently, a planned transition of a remote primary healthcare service from government management to community control increased utilisation of primary health care by 408%. Let me repeat that. 408%. This transition accelerated immunisation rates, reduced the proportion of babies born with low birth weights to less than 10%, and increased employment of qualified Aboriginal and Torres Strait Islander people. As a sector, we are especially proud of our ACCHOs, that our ACCHOs are among the largest employer of Aboriginal and Torres Strait Islander people in the country. We are powerful advocates for action on social determinants. Consider public housing and environmental health. The major issues of overcrowding of Aboriginal and Torres Strait Islander housing largely results from the need to share housing due to the lack of supply, low incomes and high rent. My people deserve affordable, adequate, safe and sustainable housing. Like yours, their health depends on it. And of course, this became very clear during 2020's COVID-19 pandemic. 2020 has been the year like no other. It illustrates precisely why community-controlled primary health care is so vital to Aboriginal and Torres Strait Islander people if its health is to improve. We began 2020 with no inkling of what was to come. A novel coronavirus hitched a ride rapidly around the entire globe. What we discovered very quickly was its propensity to strike the ageing, those with coexisting chronic conditions, and as a contagious virus readily spread by droplet and formite transmission to those in overcrowded housing. Chronic stress, lack of personal resources and poor nutrition through food insecurity also raised the stakes for effective public health responses. Our sector mobilised quickly because we had to. By the end of January, Apuna Pina in North Queensland was already thinking through the risk and response for Aboriginal and Torres Strait Islander people in the Cape region. CAMS had also ordered PPE for all its member services throughout the Kimberley, and some remote communities were already closing their boundaries to all visitors. At NACCHO, we quickly convened an internal group of CEOs and our member services and public health medical officers to get our heads around this new virus, its implications and critical issues for our people. In February, I was an early advocate with the Northern Territory Land Councils for border closures and protective biosecurity measures to keep our communities safe. Fortunately, government listened to us. In early March, the Aboriginal and Torres Strait Islander Advisory Group on COVID-19 was established. NACCHO co-chairs this advisory group. It links to the Communicable Diseases Network of Australia and reports to the Australian Health Protection Principal Committee. I am grateful to ANU for Dr. Jason Agostino, who worked very closely with us on this and attended all our advisory committee meetings and still comes over to the office once a week. But just as important was that our services were on the ground, 143 of them distributed very widely around Australia and very strategically in remote areas. Informing communities early about the facts supporting community with local pandemic planning, using social media, radio and local leaders to spread the word, solving problems like soap in schools. You know, Western Australia cut out providing soap in schools in WA, so we had to solve that problem. New rules for sorry business, funerals, and working out how to ensure medications got to people in quarantine, and we introduced daily health monitoring systems for anyone at high risk. We used desktop exercises to stress test our response plans. We shared our expertise and kept communities safe. While we were busy implementing on the ground, we were also front and centre in the national pandemic policy. Our sector ensured legislative changes, including the Biosecurity Act, to enable the necessary restrictions to be put in place quickly. National Aboriginal and Torres Strait Islander public health guidelines, including evaluation criteria, standards for isolation and quarantine, social support, clinical care and community-wide COVID-19 screening. Immediate telehealth uptake that kept our people well. It was amazing how well our people responded to telehealth. Rapid PCR testing in over 80 remote communities. We already had about 36 of the machines that we were using for other tests. All we needed was the new cartridge to add to those, and then we quickly scaled up to bring 80 of those testing machines as close to communities as possible, no less than a 2-hour drive, to make sure that we could get all the testing done. Workforce surge capacity planning and infectious disease modelling. This was a fantastic effort and it worked. As at November the 22nd, the last available figures, there have only been 147 confirmed cases of COVID-19 notified in Aboriginal and Torres Strait Islander people since the beginning of the pandemic. This represents 0.5% of all confirmed cases and only one case in remote Australia. There have been no deaths from COVID-19 among Aboriginal and Torres Strait Islander people. This means we have lost not one elder to COVID-19. Due to coding gaps, we are yet to fully quantify the extent of testing among Aboriginal and Torres Strait Islander populations, but point-of-care testing options have certainly increased access and trust. We continue to be vigilant. Border openings increase risk. The median age for cases among our people is 31 years of age, which is quite a bit lower than for non-Indigenous populations. The extent of comorbidities, overcrowding and socio-economic disadvantage is always a concern. As Dr. Mark Wenatong has explained, any vulnerability of our remote communities to COVID is much more related to the long-standing underinvestment in health infrastructure than to people as individuals. It is this health infrastructure that is now my priority. I am pleased that the Minister for Health announced a more sustainable funding model for the community-controlled primary healthcare sector at our NACCHO conference in Darwin in November last year. While very welcome and a major step forward, it is only a first step. In conjunction with the Commonwealth Department, we are now harnessing the expertise of the sector to define the core services and outcomes of comprehensive community-controlled primary health care. This work will culminate in an agreed core services and outcomes framework mid-next year. This framework will explain the breadth and impact from what community-controlled health services do. It will describe the full scope of services essential to improving our health. This framework will also articulate the accountability we have to our communities. This is a very powerful motivator for our sector, and we are bound to the bedrock of culture that informs everything we do. This framework will also inform the basis of a needs-based funding model for community-controlled primary health care. This is seminal work, driven by the sector, controlled by the sector, owned by the sector. I just hope to goodness the government owns it when we go to them with the bill. NACCHO's leadership has also been, many of you will recall the original Closing the Gap arrangements that had been announced in 2008. Annual reports were tabled in the Federal Parliament. There was always a speech by the Prime Minister and a right of reply by the Leader of the Opposition. Yet the disappointing outcomes from year to year were readily predictable. First Nations people had been largely excluded from the original concept, negotiations and policies. By 2017, it was clear that the hopes for closing the gap had not been realised. It was also clear that goals and targets are useless without structural reform, and clear that governments needed to stop talking to each other and start listening to us. I was very perturbed. My fellow First Nations leaders were also worried. We had to step in and rescue the process. NACCHO was instrumental in galvanising a cohesive group of Aboriginal and Torres Strait Islander community-controlled peak organisations to do exactly this. Our coalition of peaks negotiated two vitally important agreements, committing governments to change the way they work with our people right throughout Australia. The first is the Partnership Agreement on Closing the Gap, which commenced in March 2019. So after COAG agreed to work in partnership with us, full partnership with us in Adelaide in 2018, December Adelaide in 2018, I said to the Coalition of Peaks, don't take holidays, we've got work to do. We drafted the first partnership agreement, and when the bureaucrats got back to work at the end of January, put it on the table. And then we negotiated a few more weeks with them, and we got it signed off by myself and the First Ministers of every government and the President of the Local Government Association by March. They couldn't believe their eyes. The partnership agreement cements the partnership agreed to by the Council of Australian Governments as it was then. This work is being continued by the National Cabinet. There is a formal COAG partnership with Aboriginal and Torres Strait Islander community-controlled representatives to share decision-making on closing the gap. The subsequent national agreement on closing the gap was negotiated under this partnership agreement. It was launched on the 27th of July this year by the Prime Minister, the Minister for Indigenous Affairs, Ken Wyatt, and myself. It binds us all to 4 priority reforms. These are: 1, ensuring Aboriginal and Torres Strait Islander people own governance and decision-making structures are fully supported, and that we share decision-making with governments. The second is recognising community-controlled organisations are an act of self-determination where Aboriginal and Torres Strait Islander people deliver services to their communities based on our own needs, cultures and relationships, including to land. Confronting institutionalised racism in government, mainstream institutions and agencies. Hospitals is a big area that we'll be targeting, and we want, all the help we can get with our partners. And the fourth reform priority is sharing data and information with Aboriginal and Torres Strait Islander people at all levels to ensure they have more power to determine their own development, so that when we have negotiations with government and we're trying to get to a shared, agreed outcome, we have the necessary data to inform, evidence-based data to inform our people participating in those negotiations. It is because of our experience in leading Aboriginal and Torres Strait Islander response to COVID that the nation has signed up to further strengthen the Aboriginal community control sector. We commit to co-design implementation on the ground and accountability. In health, this will be a major feature in the revision of the National Aboriginal and Torres Strait Islander Health Plan. It will drive sector strengthening plans and true accountability across all parties for health improvement. It is an exciting time. We know control, self-determination and community empowerment directed by First Nations peoples will work. Nothing else will deliver the outcomes we deserve. Please join me moving forward. Thank you very much for this award, which I accept as an expression of your confidence in our sector, and I share with all of our sector whose efforts helped us to prevent COVID-19 having such a devastating effect on our people. Thank you.
I know we're not supposed to be shaking hands, but there you are.
We'll have to do that. We can't do anything else.
We can't do anything. Thank you, Pat, for your truly inspiring and very informative speech, and for the challenges you've thrown at us, which, what a formidable person. Can you imagine a minister standing up to Pat? Not a way. But Pat, that was a marvellous presentation. Congratulations on your Sidney Sax Award, and there'll be an opportunity later in the program for questions. Thank you. I would now like to invite Professor Robin Lucas and Dr. Anna-Greta Hunter to the stage. During the 2019-20 bushfires, the ANU College of Health and Medicine's Bushfire Impact Working Group, chaired by these two, was established to respond to immediate and longer-term health needs related to the physical and mental health effects of bushfires and smoke in communities in the ACT and South Coast, New South Wales. For many of you in the audience today, you will remember that this time last year, Canberra was blanketed in a thick cloud of smoke that lasted for weeks and saw this beautiful city regularly featuring at the top of list of cities with the poorest air quality worldwide, a fact that Russ has already alluded to. I live in Sydney, and I can see the top of Sydney Harbour from a bridge from my home, not a sight of it for weeks. So I understand what it was like here. For many of you, your Christmas holiday plans for a beach holiday at the South Coast were put on hold as communities across the region burned. None of us will forget the horror of people gathered on beaches waiting to be evacuated from burning communities, our iconic animals suffering agonising deaths, and the devastating impacts on both the physical and mental health and well-being of people in so many communities. The ANU team brought their clinical and research skills to the table, together with primary and acute health sector leaders, to respond to this emergency. In addition to supporting immediate care needs, research projects have been initiated to study the health and health systems effects of fire and smoke, including the measurement and assessment of air quality effects on lung function and medium to long-term impact related to pregnancy and children. This work has had wide impact, including on the recommendations and findings of the Royal Commission into National Natural Disaster Arrangements. Robin and Anna-Greta, it gives me great pleasure to honour your work and that of your working group with our second Sidney Sax Award. Congratulations, and thank you for all you have done and for the work you yet to do as part of your ongoing commitment to make Australia safer and healthier. And I would like to present you with this award. Thank you. Congratulations to both of you. Take that as a handshake.
Yeah, thank you.
And I'm going to stand in the middle for a photo.
Okay, sounds very good.
Are we going to take a photo? There you go. Thank you. Thank you. Would you like to say a few words?
Yes, please. Thank you. I'm too short. I've printed off in 14 font, but I think it's safer if I wear my glasses. I'd like to begin by acknowledging the traditional custodians of the land that we're meeting on today, the Ngunnawal people, and paying my respects to elders past, present and emerging. I extend that acknowledgement and respect to all Aboriginal and Torres Strait Island people who are here today. I was really struck when Auntie Violet was up here talking about being a Ngunnawal person, living on Ngunnawal land, and all of the generations before. You know, she's still in her home. That's just amazing. To the Australian Healthcare and Hospitals Association, thank you for the privilege of being co-awarded on behalf of the Bushfire Impact Working Group the Sidney Sax Medal in 2020. I feel very honoured to be part of the group that was co-awarded with Pat, and thank you for a fantastic presentation, Pat. So I'm going to tell you a little bit about the Bushfire Impact Working Group, how it came to form and its initial work, and then offer some reflections on the leadership, generosity, broad expertise and willingness to do a bit more for the well-being of the community that made the Bushfire Impact Working Group both possible and effective. Then I'm going to hand over to Anna Greta to talk about the group's achievements and the bigger picture, the role of climate change in the bushfire disaster. So I love working in January. I have a nice holiday in December every year in New Zealand, where I should be right now, except I can't go. And then I come back to work and nobody else is there. It's a time to get work done. It's a quiet space, a gentle pace, but not this year. New Year's Day was on Wednesday. I, like others no doubt, planned to work at home on Thursday and Friday and be back on campus on Monday the 6th. But on that Thursday, January the 2nd, the ANU Provost emailed all of us to say the campus was closed until the 8th because of the bushfire smoke. And in the days after the 8th, the combination of smoke and heat resulted in advice to work from home. Given that I didn't have an air-conditioned office, I do now, staying at home seemed like a really good idea. But there was no quiet start in the College of Health and Medicine. On Sunday, the 5th of January, our Dean, Russell, sent a college-wide email seeking input on how we as a college could best contribute to supporting the health and wellbeing needs of affected communities, including our own at the university and in the ACT that were affected by smoke, and then fears of encroaching fires, and on the South Coast, where the disaster had been unfolding, as Russell said, since mid-December. So over the next several weeks, a rather ad hoc group, which I think was people who Russell could easily access their email, who happened to be in Canberra, some on holiday, some not on holiday, assembled, as Russell said, off-site, either at Russell's house or at Anna Greta's clinical suites, for many hours every day, day after day, like I'm talking 3 or 4 hour discussions, to discuss and plan how our college could best respond. We quickly recognised an immediate focus was filling the information gap on how to be safe in the bushfire smoke, with communication that was accessible to communities and evidence-based. We worked with ACT Health, the Chief Health and Medical Officers of the states and the Federal Department of Health, and communities to disseminate evidence-based communications. That work has already been recognised in 2020 with the Advocacy and Leadership Award at the Australian Public Health Conference 2020. At the same time as that huge piece of work was underway, we developed 4 broad themes of research to understand the impacts and provide direction for interventions to support physical health, mental health, communities and social functioning, and the health system response. Once we established those themes, a large and somewhat random and varying group was narrowed down to 2 or 3 leads for each of those themes and supporting college staff, and that became the Bushfire Impact Working Group. However, although that small group is the actual Bushfire Impact Working Group, I see this award as also including that wider initial group and those that are undertaking the ensuing work. I led the Bushfire Impact Working Group after Russell went overseas in late January, and during the process that leadership core was developing. So I'm going to let Anna-Greta tell you about the work that has resulted, because I was only really there right at the very beginning. But preparing for this talk, I've reflected on the different leadership styles involved and how they seem to be just right for the various stages of the genesis of the Bushfire Impact Working Group. I'm not sure whether that was serendipity or if it reflects the ability to shift leadership styles to suit the task. So Russell had the idea. He pulled us together and he let us run. We talked and talked and talked, and sometimes we felt like we went round and round in circles. But he gently sort of nudged us and led us, and over time we were able to coalesce into these 4 themes with some sub-themes within those. So this type of leadership was absolutely essential to the group at the time. But I'm not that sort of leader. I'm too impatient. I like to get things done. So when Russell left at the end of January, I took over leadership of the group. My focus was on ensuring that we had research across all of those 4 themes that we had identified and had decided were important. So people were tapped on the shoulder to develop and lead projects and form cross-disciplinary teams. Our meetings became shorter and sharper and focused on ensuring we were covering the scope of the work, that we were collaborative across the 4 schools and the college, and that we were guided by the needs of the communities and other stakeholders. When Anna-Greta was appointed as the Human Futures Fellow, which I think was early in March, she took over as lead as I turned my attention to the next 2020 crisis, COVID-19. Anna-Greta's a big picture thinker, and this is just what the group needed as it evolved over 2020, and I'll leave her to tell you about that. The Bushfire Impact Working Group could never have happened without the generosity of spirit of the staff involved, right from the first large group meeting on the 6th of January. We could have enjoyed some extra time at home while the university was closed, although little did we know how much time we would spend at home over the rest of 2020. But these people came out on the 40+ degree days when Canberra had the worst air quality in the world and met for hours and hours. Everyone pitched in, threw ideas into the mix, critiqued those ideas robustly but respectfully, edited many drafts of communications, tapped into all of our personal contacts in our networks so that we were communicating with emergency services, chief health officers, departments of health, communities at risk, translation services, and so on. The Bushfire Impact Working Group could never have happened without the broad expertise available within the college and the willingness, even eagerness, to embrace collaboration across different disciplines within the college as we had never done before, to ensure that we had a holistic approach to our response. So I'm incredibly proud of the Bushfire Impact Working Group, how we came together and we got work going, and incredibly pleased that the Australian Healthcare and Hospitals Association has recognised their work through this award. So thank you. I'll hand over to Anna-Greta.
Thank you, Robin, for that fantastic overview of the early parts of our work. I too wanted to start by saying thank you. Thank you for hosting an event in a physical location. It is so wonderful to speak to an audience again. Thank you to the Australian Healthcare and Hospitals Association for having us here and for the extraordinary honour of receiving this award. I wanted to thank Auntie Violet for her welcome to country. It's humbling to be given welcome to a place which has had continuous ownership for such a long period of time, and recognising Indigenous ownership of the land that was never ceded is a really important part of the work and the understanding that we have. I'm going to start with a story too. On the 31st of December last year, I was on call at Canberra Hospital for general medicine. That night I went out to a friend's place. They have an annual New Year's Eve party, and yet last year's event was somewhat more muted than usual. Driving there was a bit of a challenge. Extremely thick smoke and very poor visibility. It was hard to see to the end of the street. When I arrived there, of course, it was a really hot night and smoke was filling the rooms. But I think probably more significantly, every single person who attended that evening had someone of significance on the south coast of New South Wales. We were spending time thinking, talking and reflecting, concerned about those friends, family and loved ones who were facing an extraordinary evening. So just the next slide, sorry, I don't have... My family were here. It's the only slide that I've got. They were at a National Trust lodge down south of Eden, just up from Malakuta. And you might remember some of the vision from Malakuta at that time. So they were bathed in heat, smoke and fire embers. Their New Year's Eve story was one of disaster preparation, hourly group meetings, a night sentry who was watching for flames. They had an evacuation strategy that involved the wharf into the middle of Twofold Bay. And yet this is just one of so many remarkable stories of that New Year's Eve night that has been scored into Australia's memory in the middle of what was a devastating summer of fire. Australia has always had bushfires. And we've learnt from previous bushfire events such as Ash Wednesday, Black Saturday and others. We know that the health impacts are heterogeneous, tragic loss of life directly from fire. The environmental conditions that create these devastating fire events have other health impacts, such as loss of life due to heat. The health impacts are physical, smoke and fire and heat that affects our cardiovascular system and respiratory system, affects our immune function, our endocrine function, and often affects us quite directly physically. But the other manifestation, of course, is in the psychological territory, with both immediate and longer-term impacts of trauma resonating through our lives for many years. The Bushfire Impact Working Group emerged in this complex milieu of acute disaster, and Robin's done a superb job, I think, of painting the picture of those early weeks and months. We had at that point, weeks of hazardous air pollution, with vast tracts of Australia bathed in smoke. The events had engaged our academic curiosity, but probably more importantly, our community responsibility and a really strong personal drive to better understand the health impacts of the events that were unfolding around us. Of course, by March, when I was given the opportunity to take over as chair, the research questions had been established and many of the projects were underway after the able stewardship of Professor Robin Lucas. But in March we had that new challenge. The novel coronavirus pandemic that emerged in January was becoming a really clear risk, and we were heading into lockdown. In 2020, many of us have learned that invention is a good response to adversity. The response of the public health workforce across ANU and around Australia to the coronavirus pandemic has been extraordinary and as described elsewhere. But for many of the Bushfire Impact Working Group projects, our projects had to change practically. There were practical limitations to what we could do, the most obvious of which is probably our investigation of alterations of lung function. Lung function testing was shut down across the country because of the coronavirus pandemic, and we've had limited access to that data at that particular time. But many of our researchers also took on new roles, assisting and coordinating in the coronavirus response at both a state and at a federal level. And probably most notably amongst that was Nick Coatsworth, who was coordinating our lung function investigation, who stepped up as a new Deputy Chief Medical Officer. I have to say each member of the Bushfire Impact Working Group had some sort of role or research disruption of significance, not least of which was working from home. So during this period of extraordinary disruption, we as a group had an extremely strong awareness that the bushfire-affected communities could not be forgotten, as our national focus was shifting towards the pandemic. Our researchers continued working with populations along the south coast, including the Aboriginal community in Mogo. Much of our work now done by telephone or online, we have delighted recently in being able to re-establish those face-to-face working relationships. So what have we achieved in this year of unprecedented change? Well, we've had many and varied activities and successes. I think at its core we've met regularly. We've shared ideas, we've shared data and strategies on how to get the best from the challenges that have been thrown at us. And it's been these regular meetings of the team which have maintained our momentum and provided support to the projects. We had some early work demonstrating that the support for healthcare workers and adequate resources for healthcare workers is a crucial part of early disaster management after an event like a bushfire. And that's gone on to inform some of our ongoing projects that are looking particularly at psychological support during bushfire events. We've worked hard in the policy sphere where we've engaged with communities and policymakers. This clearly started in the first weeks when we engaged with both the ACT and federal governments and the New South Wales government on smoke communication, but has continued throughout the year. We participated in the Emergency Leaders for Climate Action Roundtable that was run over multiple sessions via Zoom and coordinated by the Climate Council. This forum was a good opportunity for us to share what we already had learnt, either from previous events or from the recent stuff, but also allowed us to engage and listen to ongoing community concerns that were being raised by the communities that had been affected by bushfires. We made submissions to the Senate Finance and Public Administration inquiry into the bushfires. That committee then invited Sotiris Varoufakis and I to meet with them and to discuss what we knew about the health impacts of bushfires and where the gaps in knowledge might exist. We explained what we knew from previous data, and we also highlighted the extraordinarily unprecedented severity of this event, that the data that we have historically does not reflect the events that have taken place recently, and the tremendous importance of being able to gather and understand the health impacts of Black Summer. And I think the interim report that's been released by that committee reflects a lot of that conversation. We provided a submission to the Royal Commission into Natural Disasters and, of course, into their issues paper that specifically looked at the health impacts of the bushfires. They were thinking particularly about health system responses, primary care responses and air pollution monitoring, and we addressed all three of those areas through our experience. We've called for a national strategy into health and climate change and for a broad, integrated, whole-of-system response. The Royal Commission response is that final report released a month or so ago, is a remarkable document that I commend to everybody. And as we articulate adaptation strategies for natural disasters in the future, I know we will continue to reference the work that's come from that Royal Commission and from the submissions that we made toward that final document. We've had data from an early rapid assessment of the impact of prolonged bushfire smoke exposure. This was coordinated by Rachel Rodney-Harris. And we know from that data that 9 out of 10 people living across this region experienced at least one physical symptom during this period, and 50% of people had significant levels of anxiety. It did feel apocalyptic. It felt like the world was ending, and that's reflected in our data. This was the beginning of ongoing studies that are continuing to assess the psychological impacts of bushfire smoke, and of course, in parallel, many of those studies now incorporate the coronavirus pandemic. We did work with the Black Dog Institute in providing psychological support to bushfire-affected communities as well. I think a central question that comes up from the natural disaster events like Black Summer are the biological impacts. We've looked at lung function and we hope to understand if there has been a change in lung function after months of bushfire smoke exposure or not. Preliminary data might be reflecting a small change in our lung function, and I have to confess to a strong desire to know not just that short-term data, but long-term follow-up. What is the 10-year follow-up for those of us who've had that bushfire smoke exposure to our lungs? And I know that question is really shared in our community. I remember in November, before the major period of bushfires in this region, having media asking about what sort of advice to give pregnant women who were living with protracted periods, even at that stage, of poor to hazardous air pollution. What we know is that from cities who have air pollution where it's hazardous levels, that this does impact on pregnancy outcomes. But we do not know the impact of months of bushfire smoke exposure on pregnancy. Coordinated by Chris Nolan and through the Health Answers Network, our Mother and Child 2020 study is aiming to answer this question. As it stands, we have more than 1,000 women who were pregnant during this period who have been recruited from around this southeastern corner of New South Wales and the ACT. I think this study is of central importance in trying to answer that question about bushfire smoke and the biological impacts, particularly in pregnancy. so we can inform and give the best possible advice when we're asked that question when the next bushfire season arrives. And it will arrive. I confess to not wanting this to be true, but we have to acknowledge as scientists that we are likely to face a summer of that horror or worse at some point in the next few decades. For the next event, I would like to see our health system, our health research response, and probably most importantly, our communities proactively prepared to respond to events that can be catastrophic. The Royal Commission into Natural Disasters, I think, offers us some of the roadmap that will help us to reduce the health impacts, either psychological or physical, by helping communities to really prepare for this increase in extreme weather events that we know will occur as a result of our changing climate. So finally, I would like to express my gratitude. I'd like to thank the Australian National University for their investment in the response to the Black Summer. I'd particularly like to thank Professor Russell Groun for your vision and leadership in bringing this group together. Your support and your commitment to the research and to the researchers has been remarkable. And the practical investment of financial support in events like this really needs to be noted. It's an essential underpinning of the sort of work that's been done and achieved so far. And so the investment of ANU needs to be noted, acknowledged. I know I'm sharing the gratitude of our entire group. Although this is unfortunate, it's actually true that investing in the health impacts of climate change will make great returns for the health of our communities in coming decades. The federal government's beginning to realise this as they reinvest in environmental impacts to health by supporting the bushfire impact with a $5 million grant from the MRFF directed now towards 9 studies, including 2 research groups here at ANU. And yet much of our environment and health research is unfunded. And so I particularly wanted to make note of the researchers who are working on the Mother and Child 2020 study. This study involves many researchers from different schools across ANU and many healthcare practitioners from around the southeastern corner of New South Wales and the ACT. As it stands, this study is unfunded. And yet I have a deep confidence that this study will continue and be completed, as there is such extraordinary commitment to answering this crucial clinical question from those people who are working in the health system. We need to know the answer to the question and we will find it regardless, but it would be lovely to have some additional support. This Bushfire Impact Working Group has demonstrated the importance of interdisciplinary approaches to complex challenges such as the environmental influence on health and wellbeing. Bringing together academics from areas that commonly work together, public health, psychology, clinical medicine, our group deliberately extended that invitation and the work to climate scientists, disaster risk scientists, science communication experts, and many others across ANU. The list, as Robin explained earlier, of participants and members of this group has been a long one, and so rather than naming each participant individually, I really would like to acknowledge all of my colleagues for their extraordinary work. This award is for the group. Climate change is the dominant global health challenge of this century, and for the most climate vulnerable developed nation, Australia will lead the world in framing deeper understanding of the relationship between environment and human health. Thank you again to the Australian Healthcare and Hospitals Association for your leadership in articulating and supporting our evolving understanding of the challenge to health and wellbeing from our changing climate. Climate change and environmental risks magnify health risks conferred by the social determinants of health, and we know that action on social, cultural and environmental determinants of health has such potential to improve population wellbeing. Our Bushfire Impact Working Group is so proud to have received today's Sidney Sax Award alongside Pat Turner, and thank you again for your wonderful speech. Thank you everybody for your attention.
Thank you very much indeed, Robin and Anna-Greta, and congratulations once again to you and to you, Russell, obviously, and the full team of the Bushfire Impact Working Group, and to Pat Turner on these very well-deserved awards. Pat, would you mind joining us back on stage? We're going to have a Q&A session now. And I'll hand over to the Chief Executive of the Australian Healthcare and Hospitals Association, Alison Verhoeven, who will invite our audience to put forward questions to the three of you, and it'll be both those of you here and some who are online. Alison, do you join us?
Thanks very much, Jillian. Russ, would you like to come up and join us on the stage as well? Because I think you've probably got something to contribute to the discussion as well. We've got people who are joining us online around the country at the moment, and I know some of them are probably putting some questions forward, and I'm sure some of you have some questions, as indeed I do, for our panellists. The process during COVID-19 is that we have to come to the microphone here in front. We can't actually have a roving microphone because of COVID. So I might just start. Kylie, do you have any questions from anybody online that you might like to pitch for? You don't, okay? That's fine. Anyone in the audience wanting to put a question forward at the moment? Or are you happy for me to put my question forward? Rebecca, okay, come on down. Feel like I'm a television host. Come on down. Here's the prize.
Hi, Rebecca Haddock from the Australian Healthcare and Hospital Association. Pat,
Rebecca, just come a bit closer to the microphone, yeah.
Pat, I was just wondering, what lessons can we learn from the COVID-19 experience that we can take into Aboriginal and Torres Strait Islander health policy moving forward?
No, you've got yours, yeah.
Is that on?
Yep.
I think that what worked really well was our communication with all our member services and making sure that each service felt that they had the authority to communicate more broadly with the community that relied on them. And, you know, we kept on checking about supplies for PPE and whatever. That was a bit messy because of the distribution thing. So we learnt a lot about communication being the key. And also cooperation and collaboration with anyone and everyone that had something to offer. So our relationship with the Commonwealth Department of Health has always been a good relationship, and that really benefited us during COVID. And because we'd had dealings with Brendan Murphy directly as well, and Tony Kelly also has had extensive experience in Aboriginal health, those sort of connections were just vital in terms of our voices being heard. I used national media quite effectively to make sure that the decision makers understood the threat of COVID and the devastation that it would cause if it got into our communities. So communications, collaboration, coordination and partnerships were strengthened, absolutely. I had, like CAMS in Broome, was meeting with all of the key stakeholders every morning at 7 o'clock. Every morning. The Shire, the State Health, any of the, the Chamber of Commerce, the hospital, the police, everybody that had to be involved was at those meetings. And those meetings went on for months. So that level of cooperation, and that was all being fed back into the National Advisory Group, and the material from the National Advisory Group that we set up and co-chaired with the Commonwealth went straight to Brendan Murphy, and if I felt that I wasn't being heard, I just wrote to the Prime Minister and the Minister for Health, because there was no time to muck around. Yeah.
Thanks very much for that comment, Pat. The theme you've raised about collaboration is one I also heard in Robin and Anna Greta's presentation as well. And I would like the four of you perhaps to reflect on the circumstances that we've faced during the year, which have been ones of crisis and of complexity. And normally in those circumstances, we sort of fall back into the command and control model of leadership. You know, somebody has to take charge, somebody has to make the decisions, and everybody has to follow. But yet what I've heard from each of you today is the model you put in place, and different circumstances, but the models you've put in place were actually about bringing people together. They were community-driven, they were collaborative, they were networking, and they were embracing the strength of community to try to address problems of crisis and complexity. Can you perhaps give us some insights into why that's particularly worked well for you, as opposed to the more traditional command and control models that we might have seen, you know, in crisis situations in the past?
So you want to start with the...
Russ, you take the floor.
I'll start with a comment, but I think everybody has their own resources, what they bring to the world, and often we don't get a chance to show them in our day-to-day roles. And I think what we've seen this year is that there has been ample opportunity for everybody to shine in different ways and to bring some of the hidden resources and talents that they have to the fore to contribute to unknown territory and to working through some really challenging, never previously seen crises. And to me, that's been the most special thing, has been seeing people rise to the challenge, discover new talents that they perhaps didn't even know they had themselves, learn to work in different ways to the usual, and to succeed in that, and to make a big contribution to the community at the same time.
Thanks, Russ. Anyone else want to reflect on it?
So I would have said before the bushfires, we were 4 schools within the college who largely worked in our separate 4 silos. And the bushfires were, you know, it just happened so quickly. Everybody recognised that it needed to be an across college. We needed to be looking at physical and mental health, and they all needed to be sort of run together. When you're looking at the health of communities, there were the physical effects of understanding what air pollution was out there, but looking at the biological effects through the basic scientists and so forth. So it was great recognition that we needed to have that sort of cross-college and even across university. We needed to tap into communication expertise across the university, including translating into different languages. So we just needed to do it. And I think in many ways, having that first, then we were practiced at it, and we could use that in COVID. And it's really continued through the response to COVID as well. And so, you know, not that we would like to have that bushfire smoke stuff again, but it was our training wheels, I think, for a bit for COVID, for the way we work.
Thanks, Robin. Anna Greta.
I'm just going to follow on from what's already been said, but it's interesting if you think about the coronavirus response in terms of the practical implications in our community. The command and control model, just do what we say. So the locking up of the towers, let's say in Flemington in Melbourne, that's a command and control model. That's not nowhere near as successful as community engagement, and having communities that come together, that work together, that contend with a problem which will have messy human problems or messy humanity at its centre. So it's so much more effective, I think, when you're really facing a significant challenge and a significant threat, rather than taking the here is the single solution approach. It's much, much, much better for everybody involved, and the success levels are much higher when we work collaboratively. I think with bushfire smoke, it's easy. You're not going to find a single biological solution to the health impacts of climate change. But you can also see in coronavirus, where there is potentially a biological solution to a particular disease, that it's amplified problems with the social determinants of health. And so if we want to address really any of our serious health challenges, being able to take these broadly collaborative approaches will be key.
Pat.
So one of the driving forces for us were our elders. And it's important that the public understand that our elders are the equivalent of our universities in terms of their cultural knowledge and their ability to transmit information, a lot of which is oral or by example. And you just don't get to be told everything when you feel like knowing it. You get told it when you're ready to be, taught it. So protecting our elders was uppermost in our minds right from the get-go. And even in remote areas, and you think, how did they know out bush to close those communities? Because they started doing it before I called for it publicly, and the land councils did. And basically it was because of the elders. So our community leaders started taking our elders out to their own bush camps. So they were set up out there and kept away from the other family members, just all the elders out there with their support staff and family members looking after them. But I also think that there was a big emotional driver in how we responded. Because not only did we have the bushfires, and a hell of a season with the bushfires, we had the drought. And I was, in contact with northern New South Wales constantly because they're running out of water, and they were drinking water that looked like chocolate milkshake. And we were all concerned about the water quality. And then, of course, we had the bushfires, nearly killed us. But, the grieving of the bushfires was, for me, just hearing about all of those animals and the country being burned to a cinder. I really grieved for all of that, as much as I grieved for the loss of property and the people who were harmed. And we know, because we were connecting with our health services on the ground in Victoria and in New South Wales, and providing health service to anyone who walked in the door, not just Aboriginal and Torres Strait Islander people, but the trauma and the psychological support, and that's ongoing. I think there was a lot of emotion that drove us, because we could see the impact with all the friends, everyone having friends down on the South Coast being so badly impacted. We know what that's like because we've all had a holiday down there, and, it was our family and friends who were there under threat, immediate threat. So I think there was a lot of heart in it as well as heads, and lucky we could pull our heads together and be rational and, organised.
Thank you, Pat. Any reflections from the audience or any comments about that, the engagement of hearts and head in leadership? Thanks, Jillian. You are indeed.
Thank you. Clearly, Pat, you've had a sort of national view of how you brought communities involved in the pandemic. I'm interested to know whether the work that you've done here would have an implication or a potential effect if a bushfire, major bushfire of that kind broke out in Queensland or Northern Territory, and how important is communication in terms of the work ongoing in relation to fire?
Thank you.
It's such a great question, and I think we've been reflecting on that just recently, that we've now had 9, 10, 11 months of work that we've done on responding to an extraordinary bushfire crisis, and that we should make that asset, the asset of collaboration and communication, publicly available to any community that experiences a fire going forward. And so that's most definitely a huge part of our mission. I was also struck, I commented that I don't want to believe that it'll happen again. I know that it might. And in fact, it really struck me as I was watching the newspaper reports of what was happening in California and along the west coast of the US in September, and watching those apocalyptic skies and reports of extraordinary challenges of heat and drought and bushfire smoke. And so we've reached out to some university colleagues on the west coast of the USA And we've got such extraordinarily similar narratives. We've got the same health issues, we've got the same challenges. And we thought, well, if we work together, we're going to be dealing with similar events at the same time, and we can get our knowledge up as quickly as possible. So, look, I can't express how important it is for us individually and as a collective to be working collaboratively, nationally and globally.
Thanks very much, Anna Greta. Robin, you want to comment on that?
So, I mean, we are experiencing it now with the Fraser Island fires. I was watching them on television last night, and I wonder whether Alison's got a comment on one of the questions that we put in one of the surveys was asking people if they'd been through the ACT 2003 bushfires and how this current episode of bushfire smoke and the fear of the fires might have been amplified by having done that. I haven't seen those results. But are people in the ACT now, or people who were on the South Coast, what are they feeling, seeing, you know, are you getting flashbacks? What are the mental health effects of now seeing the devastation that's happening on Fraser Island, which just looks awful?
Alison, would you like to comment on that? And perhaps just introduce yourself so that those who are on our line will know who you are too. That would be great.
This one,
tip it down. Yeah.
I'm Alison Clare, and I'm based at the Centre for Mental Health Research as part of the College of Health and Medicine at the ANU. So the data that Robin's referring to is from the mental health impacts of the bushfires and the smoke that we looked at, and we did find there that people who had experienced the bushfires in the ACT previously, I think, were experiencing more anxiety and stress because it does I suppose, make them recall those experiences previously. So, you know, having a previously traumatic experience, you can recall that when there's a similar experience in the future. So definitely I think it's possible for some people seeing those images now would make it difficult for them at this time.
Thank you very much. Pat, I'm just wondering, clearly Aboriginal people have a long history of trauma, and some of the responses that you've endeavoured to bring into play at NACCHO has built on that trauma-informed learning, I guess. Would you perhaps be able to reflect on that and what we can more broadly take in the system around how we respond to trauma?
Yeah, well, because we've got, you know, generations, intergenerational trauma is an ongoing plague, really, and we just have to get more mental health services supported to enable families to work through these things. So not necessarily just as individuals, because the whole family is affected in an intergenerational trauma, and we don't want the younger ones having to, you know, carry that through, but that's what's happening. So it's a matter of more focus and more resources to put the right counselling and support services in a culturally safe manner in place. So mental health is in fact becoming our biggest, presenting issue in many of our clinics now, and we're expecting that to rise as a result of coming out of COVID, hopefully. Because we won't be out of COVID until we've got the vaccine rolled out and it's safe and whatever. So there's still risks, and we still have to be very mindful of it being around. But mental health is the biggest issue that we're facing, and for far too long. So we've got quite a number of our very experienced experts now working on the new plan to take us forward, and that will no doubt be informed by the bushfires and the COVID stress and, you know, with the generations of intergenerational trauma that we've been carrying.
Thanks, Pat. Russ, and before I let you talk, I've got a question for you as well, which may be part of what you're going to say anyway. As the Dean of one of Australia's leading medical schools, what's the implications of these kinds of discussions around trauma for medical education, and how do you develop a generation of medical leaders who will actually understand, be able to respond to, be empathetic and knowledgeable about trauma and the impacts on our health?
Oh, thank you. There's
A small question.
So I think this year our students have been just as important a part of the process as anybody. They were part of the surge capacity for the ACT government's response. They were doing the screening for COVID cases and the contact tracing. They've had great role models. The director of our medical school, Imogen Mitchell, became the Commander-in-Chief for the ACT's COVID response team for clinical services, and many others have role modelled tremendously. So this is while they might think that they've had a bum year spending time at home, they've actually had an incredible experience that comes only once for some generations, and our generation of graduates never had such an experience to learn from. I wanted to I wanted to congratulate you, Pat, on something I think even more significant. What your achievement has been in having such low penetrance of COVID in Indigenous communities is truly extraordinary.
Especially when you compare it internationally.
Absolutely. Well, even when you compare it in the country, and I think it speaks a lot to the way our Aboriginal community-controlled health organisations work and the function they serve. They are, pre-COVID and pre-bushfires, the role model for community health in the nation, and that should not be lost on any of us. No. We as a medical school and as a college celebrate that and think that that's a great way for our students to learn about health in a holistic sense. Yes. The value of prevention, the importance of multiple perspectives, the importance of well-being, and the integration of the environment, history, culture, land, mental and physical health, all woven in together. And so I do congratulate you on that achievement. And I think what you're seeing as a result of COVID is, in many ways, the gold standard response. I'm a trauma surgeon, for those of you who don't know, and I see everything through the lens of the way trauma surgeons have to respond. And we have this thing called damage control, which is when you're faced with a really seriously injured patient, there are 3 phases. There's the saving life, which is basically stopping bleeding and making sure the airway's intact. And then there's the supporting life, which means get them quickly onto an ICU unit and ventilator and organ support, and you can sort everything else out during that phase. And then, of course, you get to the phase of kind of rebuilding life if the patient survives that way. And in fact, if you look at COVID and the bushfires and any other crisis in life, those 3 phases are just as relevant. We saw the initial response to locking down the nation and closing the borders and putting in place physical distancing and restrictions and closing public workplaces, etc., etc. That's the first phase. The second phase is the life support, and economically that was about putting, JobKeeper and everything else, at the same time as trying to, respond to other outbreaks in Victoria and New South Wales, and to think about how we just hang in there. And then, of course, we're now moving towards a rebuilding phase and thinking about recovery. And I would say, as a nation, we really haven't done much in that 3rd phase yet. We're not imagining, as a nation, what the future is going to look like and how it might be different to what it is now. But what I've heard you say, Pat, is that you are imagining that already. Not only did you think about closing the borders earlier before anybody else was doing it and protect your communities, not only did you sustain them through this unusual 2020 year and support them in the ways they needed, but you're already leading the way, preceding the rest of the nation, with thinking about what the future holds and what it's going to be like next year. And I think we should all take our hat off to you and learn a lot from Nacho and from all of your members.
Thank you.
Thank you.
Thank you. That's really, very kind and received with grateful appreciation. I want to pick up on climate change. So we did a submission to the Western Australian Inquiry on climate change. Nacho did. And we also released a paper this year, Housing for Health. And so we take the social determinants of health extremely seriously. And there's a $6 billion backlog in Aboriginal housing in remote areas alone, $6 billion. And the Commonwealth doesn't want to have another role in housing. It wants the states to do it all, which is absolute nonsense because they've left a huge deficit there already. So we've got this big, priority going on with closing the gap. Housing's in there, whether they like it or not. But the thing is that climate change and the construction of housing is so important, is so important, and trying to, that'll be a key message that we'll be trying to get through to the housing authorities about public housing and social housing being fit for purpose in terms of the extreme weather that Australia is now going to, or the world is now going to have to live with as, until we deal with climate change as seriously as we need to.
Anna Greta, you want to comment on that, or?
No, I just think that needs to be enforced. It's an extraordinarily important message. It's one of the emerging health narratives that needs to be projected, and so certainly it's something we're very keen to support if we can at ANU. Energy security, housing security for Indigenous population, a crucial health issue.
I mean, energy security is a no-brainer, with solar and... Yeah.
We've got a question here in the audience, and then another one. Yeah.
Yeah, I'm Joanna. I do consumer health work, and just as a member of the community in the ACT, like through the bushfires, we had our emergency kit. All of my family checking with each other, did we have it packed up where we were ready to go? And sometimes I had the car packed up, and I still have things packed up. Not as much, but I'm ready to do that. And I think the thing that got us through, like I was in the 2003 fires, and we had 2 houses behind us burnt, and my daughter and I were out with the hoses on the roof, we didn't get burnt luckily, but there was, a wall of red and black, and you had nowhere to go anyway. So it's quite traumatic, knowing the fires around and, this grasslands tend to dry around the suburbs as well, that it could come again. And I hate going to the Arboretum. Like, I think they're all planting all the trees again, and I go there and think, well, it could happen again. And I had a reverse cycle air conditioner put in last year, and I've just had to have it cleaned out of all the, it stopped working because it's full of ash and dirt from the fires.
Yeah.
Thank you very much for that, bringing us back to the reality. This is actually about how each and every one of us live. So thank you for sharing that experience. So Tiras, you wanted to ask a question or comment too?
Thank you. Just, I would like to say, first of all, congratulations to Pat Turner and Nacho for the amazing achievement. It's unbelievable that they managed to control the situation so much better than other parts of the society. Given the circumstance, I think this is really remarkable. We'd like to thank very much Ras for his support and the college for the Bushfire Working Group, amazing support, and also Anna Greta and Robin for their leadership. I would like to make a comment. Working on environmental health, quite often we talk about bad things. We talk about air pollution, bushfires, infectious disease outbreaks, and I think it's important now to be able to turn this discourse into a positive discourse and a future-facing, inspiring discourse about building back better.
So can you give us some tips? What should we be doing?
So I think what is incredibly important is to build back better a society which is more sustainable, We use renewable energy more extensively. We rely less on fossil fuels. We have a more sustainable housing, better housing, healthier housing, more sustainable transport, better green spaces, better management of the forests and the fuel control. We have strategies to integrate communication, integrate cultural learnings, communities, and do that in a way which is equitable, which doesn't exacerbate inequalities in our society, and provides opportunities for the younger generation to develop their full potential. So we have more equity across the society, and also more equity across generations. So we take care of the future generations and build a better future for them. So I think it's incredibly important to turn a crisis into an opportunity.
Thank you. That's a really important point, and I think really rises on the strengths-based approach that we all would want to see in a growing and a learning health system. And I did hear about learning across the presentations this afternoon. Rebecca, I think you had a question that might have been about learning and research, one that I preceded with you even. So I might actually hand over to you to give that question now.
So I think you've all demonstrated how powerful it can be to translate evidence into policy and practice. And I know you touched on the MRFF, but how do you think climate and health research can be better supported so that we have a more sustainable and equitable health system?
Who wants to take that challenge on?
Well, I'm just going to say that I think we as a global community now are firmly convinced and of the view that health has biological, psychological, social and environmental contributions to it. And there's just no escaping that fact. And so I think that means we need to be doing good research in all of those areas, and we need to be doing activist work in those areas to make sure that we're progressing as a society and as a global community, and that future generations have an opportunity to live healthy, productive lives. And I think the obvious implication, and I can probably say it as Dean, is that there should be resources directed to supporting research in all four of those aspects.
Yeah. Thanks, Russ. Pat, as an activist, how would you like to see research invested in Australia, and what particular guidance might you give to our leaders around investments in research?
Well, I think, climate change is a reality, despite the deniers, and the science is very clear. It's finding the right solution, so I think the investment should be far greater, but I think corporations can invest as well, as long as they're not getting some sort of, what do you call it, I don't know, so they're buying their way thing. It's a fair income research project that is independent and not dependent on returning something to the sponsoring company. But government, the government, we all know this government has been very naughty when it comes to climate change, and it's really got to pick up its game, because the young generation are not going to cop it. I'm really proud of the younger people who are taking a leadership role, and I do everything to encourage them and and support them. But we can't just sit back as adults and leave it to them. We've got to take every opportunity to remind decision makers and influencers in our communities that everyone has a responsibility to face up to this and to get better outcomes than what we've currently got.
So Jillian and I are meeting tomorrow with a couple of ministers up at Parliament House. So now's the opportunity to share a message. So I'd really love to hear from each of you, and perhaps following in the sort of vein of that Satiris gave us about, looking forward in a positive way, but also the reality that our consumer commentator has made around, what this means to each and every one of us in our daily lives. What's a key message that you might like Jillian and I to deliver tomorrow to Minister Hunt? And I might start with Anna-Greta and come back right down the panel to Pat at the end. So Anna-Greta, a key message for Jillian and I to share with Minister Hunt tomorrow.
I think this year has shown us that the solutions to complex health problems lie outside hospitals.
Yep.
I think they lie in our society, I think they lie in our community, I think they lie in our environment. And I think if we fund those areas through the prism of their best health outcome, we can make a huge difference to the wellbeing of Australians.
Thank you. Robin.
Well, being a public health physician, I'd be talking to Greg Hunt about building public health and supporting public health workforce, which we've seen come to the fore during COVID and during the bushfires. And I'm not 100% sure Minister Hunt fully understands what public health medicine is or what public health is. But it is, you know, it's prevention but more than prevention. So investment, so funding for climate change and health research, absolutely. But also the importance of public health versus perhaps hospital-based clinical medicine.
Thanks, Robin. Russ.
I'd be first congratulating him because we are a fortunate community in an amazing position, and it doesn't take too much comparison with what you see on TV and the internet about the way the rest of the world is existing at the moment to realise that we, the great good fortune of being an island nation at the end of the world, but through a whole lot of policy decisions, are in a great position, and we're grateful for that. So please pass that on.
Thank you. We will do.
Secondly, well, so the second point is linked to that. It is that Australia is now ready, absolutely ready, to succeed and to be to lead in many ways, through public policy, through research, through service delivery, through communicating that knowledge, through leading the global community through a period of great challenge. We've got absolutely amazing talent in this country. We punch way above our weight in terms of impact per capita and per capita of researcher, and it's a treasured, prized community that we've got here, and we must make sure that we can support their future and thrive as a nation because we're supporting them.
Thanks, Russ. And a last word from Pat.
What was that? I think we've demonstrated our worth this year, and that we need to continue the innovation, the collaboration and the cooperation in the best interest of getting the best health outcomes for all of our people. And so that's what I'm interested in continuing. And Greg Hunt's leadership has been pretty bloody good. You know, the demands on his time and what he's done for us has been great, and we appreciate that. He's still a bit tight-fisted with the money. But we'll come to him with our core services framework and needs-based funding framework next year.
We'll let him know.
Yeah.
And I'm going to invite Jillian back to the stage to just close off, but invite you all to stay on the stage. Thank you, and congratulations.
Thank you.
Thank you very much, Alison, and thank you, Pat, Robin, Anna-Greta, Alison and Russ for that very interesting discussion, and thanks to our audience for their interest in the work of the 2020 Sidney Sax medalists and the work they're doing. I can tell you we're going to have to speak very fast to get through this agenda with the ministers tomorrow, just to get Pat's agenda going. I mean, we want better housing, we want sustainable housing that's climate satisfied, etc., etc. We will have no renal disease will be abolished among the Indigenous community. I mean, there's so much to be done. Oh, heart disease, sorry. But also, I mean, it's fascinating as a former state health minister sitting here, listening to your wish list. I know what he's going to say. That's a state responsibility. So that's part of our task, is to persuade. I think one of the challenges is persuading, and this COVID has actually shown a better example of the Commonwealth and state governments working together. So actually working together on coming up with a collaborative funding and delivery arrangements, which is, I know, very difficult when you've got all the different state responses. I can only speak really from the point of view of New South Wales, where I think there has been reasonable collaboration. But, you know, that's me starting to burble on when in fact I'm supposed to be making closing remarks. And I do close the ceremony and thank everybody again for a fabulous day. I've thoroughly enjoyed listening to all of you, such inspiring people who are recipients of our awards today. I think you stand alongside the many thousands of people working in the health and aged care sector who've made substantial contributions to protecting the health and wellbeing of Australians this year. And importantly, your contributions will continue to make ours a better, safer and healthier country for all residents. And can I say that it's so enlightening hearing talk about public health, community-based healthcare was something I was always on about, but also the involvement of communities in designing, whether it's an Indigenous community or a cult community or a geographic area. That really, I think, is one of the lessons that we learnt this year and that you've all so eloquently articulated. And finally, thank you once again, Russ, and to all at ANU for hosting us today, and to the team at the Australian Healthcare and Hospitals Association, all of those people who have been organising behind the scenes, for your work both in preparing for this ceremony and for the terrific work you have done through 2020. I wish you all a very safe, peaceful, happy, healthy, bushfire-free Christmas holiday, and look forward to working with you again in 2021. Thank you all. Thank you.
All right. Thanks, Ross. We'll be in touch. So Jason